As we continue our coverage of the first COVID-19 vaccinations across the country, we're going to check in with a doctor in North Carolina now. In the last hour, he received his first shot of Pfizer's vaccine. Dr. Christopher Ohl joins us now. He's an infectious disease physician and professor at Wake Forest Baptist Health in Winston-Salem, North Carolina. So, doctor, we've got a picture of it. You've just had your first vaccine. How was it? How are you feeling?
Yeah, I got an early Christmas present. I'm feeling great, to tell you the truth. I didn't even know when the needle hit me. So I might be a little bit sore tomorrow, but nothing that a little Tylenol or Motrin would help with. So I'm feeling great.
Well, you said it feels like Christmas came early. What does it mean to you and your colleagues finally to have this available to you?
Yeah, this is a big deal for two reasons. One, well, maybe three reasons. One is this is going to save some lives and keeps people out of the hospital. Two, this is our way out of this. And as more and more people get vaccinated, the harder the virus is to be transmitted throughout communities and society. And then lastly, this is a really big deal in our larger war against infectious diseases because, you know, this is a major pandemic, and we've had major pandemics before. And this is the first time we've been able to get a vaccine into production, get tested, have the test show safety and efficacy with large numbers of people. And so it gives me a lot of warm feelings about when we might be challenged in the future. This is really a big deal.
You know, there's a lot of people who ask questions that maybe we still don't know the answers to, like, is this going to be something we're going to have to take yearly? Are we still going to be able to transmit to others if we've had the vaccine? But how important do you think it is for medical professionals, for yourself? Obviously, we understand why you're first in line. You guys are on the front lines of this war right now. You're going to go back into the trenches after we talk to you. But how important do you think it is for the public to trust the process, to trust the science here, that people like you are seen getting this vaccine?
Yeah, it is important for them to trust it. You know, I've seen the data. I'm an academic ID doc, so I've seen the data. I did the numbers myself. I looked at it. I'm convinced it's a safe vaccine, and the efficacy is just huge. We need the public to say, you know, this is something that I need to do, and they need to do it for two reasons. One is to protect themselves and their family. And thirdly, is to help our society and communities get out of this. We don't want the Grinch stealing Christmas again next year, and this is the way we're going to keep that from happening.
All right, first I got to ask you, what's the first thing you're going to do once you've got that booster shot?
First thing I'm going to do once I got that bbooster shot, I'll put my mask back on, and I'll continue to social distance because we're going to need to do that for a while. Because, you know, the two things, social distancing, masking, and the vaccine are going to work synergistically to get us out of this. And it is possible that people could transmit virus a little bit even after vaccination because the virus can transiently hang out in the respiratory tract, and you won't get sick, but potentially you could give it to someone. We don't know yet. So until we have all that information, we still have to do those things. But, you know, I'm going to continue to take care of patients, teach my med students, and be safe and do all those things that we know to do already to keep from getting COVID and to keep from transmitting it.
Spoken like a true professional. No Disneyland, no Disney World yet. Just going to put my mask back on, right back to work.
That's right. Yep.
Doctor, we appreciate your work so much. Thanks for taking the time to talk to us.
You're welcome anytime.